So let me start with Paulo Pertica Award. So the award was established in 2004 by the European Network of Drugs and Infections Prevention in Prisons and was made in honor of Paulo's work with prisoners relating to ensure process, access to help, access to the help and treatment for the people that were at their most vulnerable. And the aim of this award is to recognize the outstanding contribution in public health within the criminal justice context in relation to drugs and alcohol users, which can be shown to have positive impact both at the individual and general level. Unfortunately, Paulo cannot be here today with us due to personal reasons, but he sent us a message for this year's recipients. And I will kindly ask Paddy Costello, the Director of Knowledge Exchange, to present it on his behalf, as Paddy was working alongside Paolo for many years. Paddy?
As Kasia said, I was very fortunate to work with Paolo for quite a number of years. I was his manager. He aged me. The man was an absolute bundle of energy. He campaigned and worked tirelessly on behalf of people in prison who were there as a result of drug-related offences. He was also instrumental in starting the first European network of drug services in prisons. And I'm delighted to present this award on his behalf. And I know that he would have been delighted to be here too, but unfortunately he was unable to. So, our recipient this year is a physician who has worked as a surgeon at the Central Penitentiary Hospital in Moldova, commencing in 1995. From 1997, he was involved in the design, delivery, and monitoring of programs to combat TB within prisons in the Republic of Moldova. And these included in the year 2000, implementing a pilot project on needle and syringe exchange in prisons. What was known as the Moldovan model for interventions with drug users in prison, it involved a range of services, including clean needles, condoms, substitute prescribing, and counselling. And it's one that's been presented and discussed as an example of good practice at many conferences and seminars, including a large number where Paulo and myself were actually involved. And a key feature of this model, which was unusual for the region at the time, was that it involved NGOs in the delivery of services in the prisons, which was something that made the approach very special at that time. The lead that Moldova's penitentiary system took in acknowledging that, as in prisons worldwide, it was impossible to prevent illegal drugs from entering facilities and to stop prisoners from having sex with one another. And in response to this, in no small way, credit should be given to the recipient of the award. So, since his work with the prison service, he managed the Republic of Moldova's tuberculosis program implementation unit, which was financed by the World Bank and the Global Fund. And since 2006, he's been working at the Global Fund as a fund portfolio manager for tuberculosis, HIV, and malaria grants for several Eastern European countries. So, as someone who spent many years campaigning for and designing services for drug users in prisons, it's especially pleasing to make this award today to Dumitru, I hope I get this word right, Laticevschi. Please. lottery, but...
Yeah, but still, life's an interesting thing. I wanted to be a surgeon and it got me into prison. I was impatient for my professors to, I don't know, retire and give me space, so I went to the prison hospital and look where it got me.